So this is the health centre, and we're here, we're working, we're providing all the usual services, but way differently from usual. We're on the pathway now that people are accustomed to skateboarding and cycling down, but it's exclusively for people coming to the health centre currently. The 3 tents are so that we minimise the number of people going into the building and contaminating the place. But if we need to see people indoors, we have arrangements to do that, and you can see those rooms. So this is where you come if you want your flu vaccine, and you will have booked an appointment and you will have been given information about the process. And you will come and you will sit on that chair and you will bear your own arm, and the nurse will shoot the injection into you, and then you'll put your sleeve back down. And you're encouraged to wait around for about 5-10 minutes just to make sure that you don't have a reaction to the vaccine. We have never seen a reaction to flu vaccine, incidentally. We have 2 more tents out here. One tent number 1, is where we would examine people who have respiratory symptoms. Tent 2 is where we examine people who don't have respiratory symptoms, but we do need to see them rather than being dealt with over the phone or by Zoom, which is the customary way for most consultations at the moment. And some people we don't like to examine outside in the tent, and then we take them into 2 rooms that are specially reserved, our traditional isolation room and another room that is specially set up so that it can wipe down after the patient leaves. It's a very weird way of practicing, but we're dancing to a different tune these days and doing the very best we can.
What I'm showing you now is full PEP gear, and this is what we would wear if we were going to see somebody who had any respiratory symptoms. All clients or patients or students or staff that we're going to see would be seen in a tent outside, which is tent number 1, all right, because that tent means that we don't have any surfaces that we need to wipe down afterwards. So full PEP gear is, we put on shoe covers to protect our feet, and also we can of course pick up things on the ground. So you put the shoe covers on to cover the shoes, and then we wash our hands before we put on the gear. And then we put on a gown. The removal of the PEP gear is probably the most vital stage of the process. Now, because I've already got a surgical mask on and I'm going to wear an armadillo covering over my head, I don't need to put on a surgical mask, I just need the armadillo. Because I still would like to have my hair covered, I will be putting on some headgear, the armadillo. Now we work with a buddy system, so there would be a buddy with me, a nurse, who would take me out through the back door. So that's it.
Right, okay, so if we were going out to see a non-respiratory patient, we'll put on one of these masks. And then one of these aprons here. And I'm going to grab a pair of gloves. And then just move to the front of the building. We've got clean equipment in the white box, and then we move it across to the dirty box as we've used it. Here's our non-respiratory tent here, where we take cases that have no respiratory symptoms. Hi. So the patient would be sitting here, we could take their observations, etc., and then move the equipment across into the dirty box, and then put the patient on the couch to examine them, and then of course clean it all down once we've finished and take in the equipment to be cleaned down inside as well.
So this is the waiting area, which looks nothing like it usually does because we've had to space out the chairs to keep distances. And there's our reception area, and currently patients are not allowed to just drift in. But we will revert to being more liberal with time, and that is why we have the perspex screens in front of each receptionist and the barriers that security kindly put up for us to keep patients' distance from the reception desk. Normally we would have 5 receptionists in here working and doing admin. To reduce the contact between them, we've currently got 3 working, and the other 2 who are doing admin work have gone to consult rooms to do it. This just limits the density of staff in any one area. And you'll notice that they politely wear masks to protect one another from any old germ, not necessarily COVID. So as you noticed when I took you on the tiki tour of the health centre, the doors to the consulting rooms are pretty much all closed, and that's because behind the doors there are doctors, nurses, healthcare assistants, counsellors, all doing their work online to the best of their ability. At the west end of the building is where we have counselling rooms normally, and the counsellors pretty much are working from home at the moment. The physiotherapists are also not in the building. They're operating from their own clinic on Rickerton Road, and we have temporarily put a hold on the Green Script Clinic and the Diabetes Clinic. But all these things will get back to normal and be restored just as soon as we can safely do it.